Hello, and thank you for listening to this presentation. Please feel free to take photos or screenshot of this talk. My name is Stina Saunders, and I'm based at the University of Edinburgh. Today I will be presenting our work on the Electronic Person-Specific Outcome Measure, or ePSOM program. The primary outcome measures currently used in the Alzheimer's disease clinical trials mainly focus on cognition. However, cognitive assessments are more applicable for a more advanced stage of the disease process where cognition is already impacted. These outcome measures may also be less important to the patient themselves than their own experience of noticing a meaningful change in their lives. So what matters to the trial participant? This can be measured using something called patient-reported outcome measures, or PROMs. So PROMs reflect an individual's view on what they define as an effective treatment, and importantly, what they consider a meaningful change. So in light of the need to incorporate the patient perspective to Alzheimer's disease clinical trials, we developed the Electronic Person-Specific Outcome Measure, or ePSOM program. ePSOM is a staged research program, and we have completed the first 3 stages of the program. So initially we conducted a literature review where we identified that there are currently no patient-reported outcome measures used in the Alzheimer's disease clinical trials, nor are any approved by regulatory bodies, even though their use is recommended. We then ran focus group studies based on the literature review, and those focus group studies yielded 5 domains of importance: everyday functioning, enjoyable activities, sense of identity, relationships and social connections, and thinking abilities. Based on those focus groups' results, we designed a nationwide survey: what matters when developing new treatments for Alzheimer's disease. While we collected some socio-demographic information quantitatively, then the majority of the survey was qualitative. So we collected free text answers across those 5 domains and asked people to provide examples for what they consider important in those 5 domains. The survey received 5,808 respondents. There were 5,808 respondents, and we received a total of 82,000 free text answers. So it's a very large qualitative data set. We used something called natural language processing to analyze the data, and after clustering this data, this resulted in 184 unique themes of importance to what mattered to people about their brain health. The survey was answered primarily by women about the age of 60, highly educated. There was also a noticeable number of people who were worried about their brain health, and we think that this represents a good sample of people who we want to include in dementia prevention studies. So these folk might be using a patient-reported outcome measure, and their views are particularly important. I'm now showing the top 20 largest themes out of the 184 themes total. This slide also shows the ordering of these themes by some key demographic: men, women, respondents up to the age of 64, over the age of 65, respondents with no degree, and respondents with a degree or higher. Now, we also asked respondents to pick answers which for them are particularly important across all the answers they gave. And this graph here shows the answers which were picked as particularly important, whereas the last slide showed the largest clusters, then this one shows the clusters which had the highest number of important answers. So the top one is family connection for many of these key demographic. We are currently at the stage of preparing manuscripts for submission to explore these data in more detail. And thank you for listening to this presentation. The work was funded by Alzheimer's Research UK.